right, so I'd like to introduce our guest speaker and co-host with me on this. So I have Dr. Packer from the University of Maryland Medical Center. Just want to run down a quick bio of Dr. Packer. So he's an assistant professor of orthopedics and sports medicine at University of Maryland School of Medicine, sports medicine physician located out of the University of Maryland Medical Center, team physician for University of Maryland, Maryland Terps, as well as the UMBC Retrievers. He specializes in sports medicine and has a special interest and focus in knee and shoulder procedures, but sees a lot of other things as well. So thank you, Dr. Packer, for joining me today.
Thanks for having me, Matt. Great to be here.
So we're going to do a little Q&A with you and just kind of run down some questions about things that you typically would see on a day-to-day, as well as we have some questions from the community that people would love to have answered. So we'll just kind of kick it off right away. So as PTs, we often get asked by our patients, what type of doctor should I see for my injury? Can you describe in your sports medicine practice what type of injuries you typically see and what sports you typically work with?
Well, first and foremost, I'm an orthopedic surgeon, a sports medicine specialist. When I say sports medicine, I don't mean I only treat athletes. We see all patients, but really my focus is on active patients of all ages getting back to the things that they love. For surgical procedures, I mostly perform knee and shoulder surgeries. For the knee, basically everything up until a joint replacement, and that includes meniscus, ACL, ligaments, cartilage, up to the most complex types of surgeries. And also with shoulder dislocations, labrum tears, rotator cuff. But I also see all different kinds of injuries. The other hat I wear is that of the team physician, where we treat competitive high school athletes, college athletes, and professional athletes. And it's just a very special, unique population that has different needs. And it's always a challenge to get them back on the field safely, but as quickly as possible. And I feel that treating that population makes me a better physician for all patients, and that I can use some of that knowledge and skills that I've developed for the high-level athlete and use that to treat all patients that I see.
Awesome. So of those patients that you get to see in clinic, of the typical injuries that you see, which ones oftentimes lead to a surgery rather than conservative management, and how could those have been prevented maybe?
Well, first of all, every patient that comes in requires a careful examination, evaluation, and it's also just as important to get to understand the patients, who they are, what they love doing, what activities they want to get back to. Because oftentimes you can have the same MRI for 3 different patients, same exact injury, but the recommended treatment might be different. Surgery might be the right decision for one patient, where conservative treatments may be the right the right treatment for another patient. So it's really important to get to know them and then talk about their expectations as well and what they want out of the treatment. But sometimes surgery is really the best choice to have the best outcome. Those tend to be injuries like ACL tears, meniscus tears, shoulder dislocations that have really been shown to have the best outcomes with surgery. But I always use the most recent research and literature to help guide our decisions.
Awesome. With you mentioned ACL. How often are you seeing that across all sports? Does it come down to more of the field sport athletes? Where are you seeing those happen the most?
Well, there are definitely certain sports where there's a higher risk, and it tends to be sports where you're cutting. Actually, for high school athletes, the highest rate of ACL tear is women's soccer, followed a short second by football. But we see it frequently in basketball, lacrosse, or pretty much any sport where you're changing direction quickly. But we also see ACL tears with all different kinds of activities as well.
Gotcha. So as a team doctor, then you probably cover multiple sports, male, female, all kinds of things. Do you have a favorite sport to cover, or maybe a favorite sport that you like to watch or follow?
No favorite. I like them all. Each sport has its own personality for an athlete, and also has their own unique risk for injuries. Whereas, for example, baseball, pitcher shoulder is its own topic in itself. Whereas a runner, for example, will have different kind of lower extremity injuries. So I find it really fun, the fun part of my job to really take each patient or athlete in the context of their sport. So yeah, I like them all.
Awesome. Well, I guess that'll lead me to a question then. So, with field sports typically ramping up right now this time of year, we have a big question mark with how things are going right now in the community with the virus. Do you typically see a big increase in the knee injuries before the season? Is it when it starts? Is it towards the tail end, or is it kind of all over the place?
Well, we certainly see injuries throughout the season, but there's a particularly high risk right at the beginning or in the preseason. It's really critical in the off season to really continue a strength and conditioning program and to stay in shape. Unfortunately, one of the more common causes of injury is an athlete that perhaps isn't maintaining with a kind of off season conditioning that they need to. And then they go into preseason, which oftentimes can be extremely demanding, and they're just not ready for it, and that can lead to injuries. So it's really important to really develop a strength and conditioning program, and also an ACL prevention program can be extremely effective in the high-risk population.
So with a lot of these athletes that may or may not see their sport this year, unfortunately, do you feel those recommendations carry over for just the weekend warrior, the CrossFit athlete, the general population that really wants to remain active and pain-free? Do those same strategies are they helpful from an injury prevention standpoint? How can people do that without gyms? What are your thoughts on some of that?
Well, certainly right now we're all in uncharted territory. We have a playbook for off-season and preseason, but that doesn't always include not having access to gyms or not being able to play a sport with anyone else. So first of all, most important is to stay safe and try to minimize any kind of risk that you can for the coronavirus. But that said, there are plenty of safe and socially distanced activities that you can do, including outdoor activities where the risk is much lower, such as running, bicycling. Inside, there are tremendous resources for home exercise programs involving just body weight, or even including just a few dumbbells or a suspension system. But also, even if you're in a team sport, you can go outside, find a safe place, a field, a basketball court, and there are plenty of individual drills that you can work on. It may not be quite the same, but everybody's in the same boat. So hopefully things will be able to ramp up pretty soon.
Yeah, absolutely. And I think that it brings me to another great question. So I asked kind of through a social media question out there, knowing that we were going to have this conversation. And kind of asked, hey, if you had a question for a doctor and you're trying to remain active or you're returning to a sport, what would those be? So I'd like to read off a few if that's okay, and then we'll kind of see what you have to say with those. So I have a question here: what is the best way to control pain that does not involve medicine? So I assume this person maybe has an injury or is dealing with one. I don't know the details behind that question. But yeah, what would you recommend non-medicine wise to control pain?
Well, first and foremost, it's important to figure out why they're having pain, to really get a diagnosis. If you have a stress fracture, the treatment's going to be a lot different versus a meniscus tear or a muscle strain. So really having that information is important. So you can either see your physician, many physical therapists have a lot of knowledge in this area, or any kind of primary care physician or professional. assuming we talk about overuse injuries, which are probably some of the most common out there, I would say first and foremost is rest. That's a treatment that's not really in the vocabulary for a lot of the really active individuals, but for many of the injuries, your body has a capacity to heal. But if you continue those activities that are putting you at risk, it's going to be really hard to get better. Elevation in ice for certain diagnoses can be helpful. I know you said no medications, but anti-inflammatories can help if it's an inflammation problem. And then looking ahead, once you've identified some of the risk factors, the goal is to help prevent the pain from coming back in the future. And that's where finding a great physical therapist that's really knowledgeable can help. And they can do a full assessment, figure out if there are any imbalances, specific weaknesses, or certain exercises and stretches that you can do to improve the way your body is working to help prevent some of those injuries from happening in the future.
Awesome. That leads right into the second question without you even knowing there. So you touched on heat and ice a little bit. Another person asked, is stretching actually, they originally said, is stretching, heat, and ice actually helpful when you are injured? But we can kind of gear that towards stretching since you mentioned the heat and ice already. So do you feel stretching is actually helpful when injured? I guess that's really dependent on the scenario there.
Yes, Matt. It really depends on the injury, but in general, flexibility is really important for not only recovering from injuries, but also for injury prevention. So especially for athletes or any weekend warriors or anyone that likes an active lifestyle, flexibility is very important. And as we get older, it becomes even more important because your body tends to stiffen up. So some kind of dynamic warm-ups before the activity is helpful, and static stretching afterwards. So it's always important to do a proper warm-up. And think of flexibility and stretching as just a part of your overall health that needs to be incorporated into everything else that you're doing.
Awesome. So with a kind of a follow-up question to that as well, these are kind of all in line with each other. I had someone from the community ask, what type of exercise can I do that won't make my injury worse? So I'm assuming they want to stay active. They don't want to stop, some type of exercise. What's your recommendation for working around an injury?
Well, again, it's really hard to make generalizations. It depends on the injury. So, for example, if you have an ACL tear, there's really no way around it. You need to see an orthopedic surgeon, because if you continue to do any kind of activities, you're putting your knee at risk of getting further damage, like meniscus or cartilage injuries. So it really depends on the specific injury that you have, and that's why it's important to find a professional that can give you the diagnosis, and that way to give you the best advice. Sometimes it's okay to play through an injury, and sometimes it's not.
Awesome. I love that. Love that advice, because that's one thing we'll oftentimes see as PTs. Patients are coming in and they've been trying to work around an injury. They've been trying to push through it, whatever the case may be. And sometimes, like you said, seeking out help from someone like yourself or someone like a physical therapist is probably the best scenario to go with.
And Matt, that's one of the biggest challenges as a team physician, is trying. Obviously, these athletes have put so much energy and time into their sport, and especially in the middle of the season, they all want to play. So it's really important for all of us, the entire sports medicine team, to determine, is this something that's safe for them to try to work through, to try to rehab, to try physical therapy, and to try treat modalities, and to do everything we can to allow the patient or the athlete to get back on the field? Or is this something where they're going to be causing more damage by trying to push it? And always, that's challenging when there's patients very motivated to get back out there. But that's really one of our, both for you and me, one of our most important jobs is to make sure they stay safe.
Yeah, and I think that's a great point to bring back to what you mentioned at, just the very beginning of our discussion of like preparation, making sure athletes are prepared for their sport and they're doing some type of training leading up to their seasons, because durability is a big reason why a lot of athletes can make it through a season. So yeah, you're exactly right. If an injury does occur, how severe, what do they need? Obviously, they don't want to miss time. So I thought that was a good point to tie back there. Another question I had from the community, and you've kind of touched on it already, when it's appropriate, but it says, do doctors recommend physical therapy? And if they do, why is it beneficial? It's a very, very broad question there, but you've mentioned it several times, when physical therapy is appropriate, when management from your end, whether surgical or even non-surgical, is appropriate. So I guess we could kind of gear that question another direction. What type of things do you typically refer to physical therapy without surgical management? What are those conservative injuries that you're seeing?
Well, obviously, I find physical therapy beneficial, or I wouldn't be here probably. um, but physical therapy can be extremely beneficial to all different types of conditions. So the human musculoskeletal system, which involves the bones, the ligaments, the muscles, it's extremely complex. So just look at your shoulder blade, for example. There are 17 muscles that attach to that shoulder blade. And if they aren't all moving together perfectly, it can cause downstream effects on your shoulder joint, your elbow, and can affect pain down there. So it's really, and oftentimes just with daily activities or doing one sport or one activity, we work some of those muscles where other ones may get tight. And so you develop imbalances. And that can be the cause of a lot of the pain that the patients are experiencing. So for example, shoulder pain, if you have a tendonitis in your shoulder, if you have a bursitis in your shoulder, I find that can be treated very effectively with really correcting the shoulder mechanics and strengthening really the smaller stabilization muscles, not just the big muscles that we all focus on in the weight room. And believe it or not, pain in front of the knee, it's really best treated by strengthening your core, your hips, and in addition to the quads. So everything's connected, and the physical therapists, this is what they're trained to do. Really, they're like detectives. So they try to figure out what are some of the not obvious causes or imbalances that are causing this pain, and then they can correct it. So even if we go to surgery, some conditions need surgery, absolutely. But after surgery, the physical therapy oftentimes is just as important as the actual surgery. Any surgery could be perfectly done, but if the patient does not do the correct rehab afterwards, they're not going to have a good outcome. And also, if these imbalances caused the surgical problem to begin with, you're just putting them at risk for having it come up again or failing if you don't correct some of the underlying causes. So personally, I think it's best if we can avoid surgery. This is the surgeon saying that. But what my job is to identify those conditions that absolutely need surgery to have the best outcome. And if not, it's almost always worthwhile to have a trial of physical therapy. And many of these patients will get better without needing anything more invasive.
Awesome. And I think leads into our last community-based question here. So where somebody had asked, and so after an injury, what should someone expect when wanting to return to 100%, or is that even possible? So, whether it's surgical or non-surgical, and, physical therapy at whatever point that may be, do you find that patients truly get back to 100%? Is that possible? What's your take on that?
Unfortunately, in sports medicine, a lot of our patients want to be 110%. But it is a common expectation for athletes. They are used to a certain level, and these injuries can really be devastating for them. And they are very motivated, eager to get back to where they were. But unfortunately, it's not always possible. The human body does not heal every injury, and some things are just not completely healable. Now, oftentimes in surgery, we can get pretty close, or we can do the best we can to stabilize the knee, or replace the cartilage, or fix the meniscus. But as we talked about earlier, it's important to really have the patient understand what the injury is, and to really have realistic expectations. If you have a muscle strain, yeah, I think with proper rehab, it's very realistic to get back to pretty close to 100%, if not 100%. If you had a bad meniscus injury and lost half of your meniscus, or have some arthritis, it's unrealistic to expect to get back long-term to where you were before in many cases. So I think it's most important is to develop a relationship with the patient, really educate them on their condition, what all the treatment options are, what to expect with these treatment options, and make sure to have realistic, not only expectations, but timeline also. After any treatment, you need to give a certain timelines, and if the patients don't follow that, they can really be affecting the benefit for the treatment.
Awesome. Awesome. Appreciate all the answers for that. I'm sure all the community questions we'll make sure we steer, our conversation back out to our community that was asking those questions. With all this going on, so I definitely want to make sure our community knows, like, where are you practicing? You've given us a lot of great information on, how you manage injuries that you see with athletes. So how could somebody find you? Where are you primarily located?
I'm primarily located in 3 different locations. Our Columbia office in Howard County, our Camden Yards office in downtown Baltimore, and we also have an office in College Park. I'd also like to mention that I'm part of a sports medicine team. There are also non-operative sports medicine specialists that have ultrasound specialty expertise, as well as the medical conditions that you might find in an athlete. So we also have physiatrists who are musculoskeletal specialists that don't do surgery. So we have a multidisciplinary team, and we all work together in all of these different locations to help provide the best care to the patients. Awesome.
I think that'll be a great resource for our community, and even for us as physical therapists, letting our patients know, we have trustworthy referral sources that we can send to. I know we've bounced a patient or two back and forth with you before, and we always hear great things coming back from our patients about the care you all give at Maryland. So we appreciate that. So I don't hold up too much of your time of your day. I would like to end with one last question. So with all the things going on with the virus, what recommendations do you have for people to, just in general, kind of steer this away from the sports medicine side of things, to remain active, pain-free, injury-free, but also practicing the proper social distancing right now that we should be?
Well, that's an important question. And first and foremost, I think it's important to understand why we're doing social distancing, and also understand just basics of how to prevent spreading a virus. Go on the CDC website, or to get a lot of that information. But yeah, certainly if you're staying at home all day, it's just important for your health, for sleeping well, and for a lot of other aspects of your life to be able to exercise. Probably even more important now than it was before, when we were all running about in our daily lives. So as we have talked about, it's important to understand what you can do to decrease your risk of getting contracting the virus. And once you have an understanding of that, it can help you determine what's a safe activity to do. If you're going to go jogging in the middle of an area where there are thousands of people, that's not necessarily a safe activity. But if you're running through a trail and you're the only person there, that's perfectly safe. So just being outside, making sure you're socially distancing, And then at home, as we mentioned, there are plenty of resources of ways to do home workouts. I'd recommend having a schedule. A lot of people have more time to do stretching, perhaps yoga if you want to do that. But I think it's very important to try to keep a regular schedule, to stay active, and every day to try to do something active.
Awesome. Awesome. Well, I really appreciate your time today, Dr. Packer. I don't want to hold you up any longer. For anybody that will be watching this video now or in the future, please check out Dr. Packer and his sports medicine team that he works with at University of Maryland Medical Center. And we'll share this info on our website and our social media so that they'll be able to find you as well. So I really appreciate your time, Dr. Packer. Thank you so much for joining us.
Thank you so much, Matt.
All right. Take care.
All right. Goodbye.